one of the ways we can start to train our deep cervical extensors and some of the flexors along with it too, getting to it with a little bit of shoulder blade arm support is kind of like a neck extension press off on a wall using a band. So the way we're going to set this up is we're going to take our standard TheraBand. We're going to have it on the back of the head. And the main thing with this is we want to make sure it's centered. We don't want to have to tilt our head back or forward too much to kind of keep it on it. So as we push forward, we want to ensure that's not going to slip up or down. So we have to throw our head tilt off, which is going to really kill the muscle tension effect. So the way we're going to set this up is we're going to have our elbows on the wall like so. And we're going to straighten up a little bit. Think of straightening almost starting from the middle of the back between the shoulder blades. So we're going to think of like a straighten up from the middle of the shoulder blades. A little bit of tension on the bands. We're almost like getting a mild like retraction extension movement through here with a little bit of like a chin tuck coming in. So we're going to come up into here. Then as we push, we want most of that push to come from underneath the scapula, more from our serratus and lower shoulder blade musculature. So as we get a push up, we're going to increase the band tension as we come up, maintain that neck position. You can put a little turn into it too, just for good measure, take a tour. Back down to the elbows, a little straighten up from the middle of the back, a little tour each way, up and down. So the main thing is we're going to start on that elbow support, make sure we have our shoulder blades set. Back, the neck is in a nice position. We kind of preloaded a little bit of the extensors with the little active motion. Then as we increase the arm length and increase the band tension, that's going to put a bit of an isometric load on the neck that it has to meet to keep it from jutting forwards. So we should feel some nice work happening down through the deep extensors, even with a little bit of grab on the deep flexor. And we should feel, if anything, a little bit of push from the lower shoulder blades as we come up through it. So just a couple of reps, up and down, little head turn to take the tour. If it allows, if we feel some tension on the neck, we can always work on getting a little more push from underneath the shoulder blades, or adjust the head position a little bit back and forth, make sure we didn't start to jut forward. The main error with this would be, especially to try and keep the band on, would be a little bit of upper cervical extension. We want to keep the neck nice and long. We want most of this work to happen from the lower neck, not from the upper, coming up like so. That'd be the major form fault. So that's one of our neck exercise variations. This can hit a lot of our deep extensors, kind of coming from the bottom up. A little bit of deep flexor, and make sure we're going from the lower shoulder blades so they don't have any tension shooting from the upper trap on it.